The rhinoplasty is a modification of the structural frame of the nose, giving a much better definition and shape in the nose. Against septoplasty, septoplasty is the modification of the inner structures that can improve the function of the nose. So there are those two different things, but we can combine them to give a much better result. The difference in open and closed rhinoplasty is only an external cut here in the lower part of the nose that is called columella, that allows us to see all the internal structures, and by doing that we can see if they are symmetric, and we can put modification, we can make modification of the same structures instead of putting in front of the structures a graft that makes not a natural nose. So that's why I prefer to do an open rhinoplasty than a closed one. Another thing with the closed rhinoplasty, statistically there's more reinterventions in a closed rhinoplasty because there are more factors that we cannot control that later it can lead to unacceptable results that the patient needs to go again to a surgery. The rhinoplasty takes around 2 hours. The rhinoplasty can be done under general anesthesia or under local and sedation. I prefer always to do it under general anesthesia. And after the surgery, we put special gauzes or splinters to avoid bleeding after the surgery and to help the patient to breathe after the surgery. Also, if we do some modifications in the bone frame, we put a splinter in the upper part of the nose. I remove them after 1 week, depending on each patient, but in average 1 week.